Hi, nice to meet you, Sue. So if you could just tell us a little bit about yourself, what you do in the NHS. We know that you're a practicing nurse, but what does that job entail?
Okay, so my job is chief nurse, executive chief nurse, and I'm also the deputy chief executive at Morecambe Hospitals. And we have 3 hospitals. We serve the population over a massive area across Barrow, Lancaster, Kendal, South Lakes. And we also have community services as well. And I'm professionally accountable for around about 4,000 people, so it's quite a big job. And I absolutely love it because every day the people that I work with make a difference.
Yeah. Okay, so if you were Prime Minister, what would you do for teenagers?
So if I was Prime Minister, and I've thought about this quite a lot actually in terms of what is it, what could we do in order to encourage our teenagers to really contribute to their local area and to their social economy.
Yeah.
And one of the things I was thinking is, what if you had an opportunity as young people to volunteer to undertake social projects such as cleaning the beaches or going and gardening in an elderly care home or going and helping out with charities, those kind of things, and of a weekend or after school. But in return for that, what if we gave you a nominal amount, a couple of pounds for every hour that you volunteer, which goes into an account that you can't touch until you're 18? What if? Yeah? What would that teach? What would that teach you? What would that say to you? I don't know if it's a good idea or a bad idea, but what it would give young people is an opportunity to start to learn to contribute to what's going on in their own area, to get to know the poor and vulnerable people that they're working with, to start to care about each other. But also, they'll be having this little tiny pot of money that will be building over the years, over their teenage years, so that when they're 18, they could draw on that to help them take that first step into higher education or a job or get the first car, whatever it is. So what if we did something like that? Now, the argument would be that that would cost too much money, we could never afford to do that. But actually, how much money do we spend on drugs,
Exactly.
treating young people with drugs, stab wounds, which you've already talked about? How much do we spend on treating young people with mental health problems? And our hospitals and services are full of people your age who have really significant mental health problems, who I'm sure something like this, and being able to get them out and working with other people who care about things, would enable them to actually get better and have a life and have a future. And imagine that the change that we would have in our society if you were leading on this as young people. Imagine the generation that comes after you, your children. What would you be teaching them? What would you do? You'd be teaching them actually to go and contribute and care about the people in your community is important.
Exactly.
So if I was Prime Minister, that's the first thing that I would do. And if that was the only thing that I did, I think that would make the future much better.
True. I'd agree with that very much. Because as I think what you said about the mental health problems, that's a very, very big thing in teenage society today. I mean, often in school we have mental health assemblies, and every single time we do an assembly, there's always someone who comes back and says, actually, you know what, that's me. I understand exactly what you're saying, and I'm in that exact situation. And it's just a huge thing, and it's kind of one of those weird things. So where people who don't have mental health problems, they don't realise how big of a thing it is. But when you do get it, that's when you realise, oh, actually, this is a huge thing. And I'm so glad someone's there. Because if they weren't there, then, where would I be right now?
And the other thing is, so, you guys are role models for your peers.
Exactly, yeah.
And for people coming up behind you, the younger people.
Yeah.
If they see you going out and doing things like that, they'll want to be like you.
Yeah.
So there's this whole thing about you're growing your own future.
Yeah.
It's amazing. The potential of something like this is absolutely amazing.
Exactly. So also, finally, what advice would you give to aspiring teenagers to work in the NHS?
First of all, I would say there is nowhere that you will work that will give you more job satisfaction. The money's not always good, and it is hard work, and people can get very, very stressed. But at the end of the day, as a team, whether you're the domestic who's keeping our hospitals clean, whether you're the porter who's moving patients and food around, the catering staff in our hospitals, you know, they cater so well for the needs of our patients. Whether you're working in a clinical job, a surgeon like your dad, or a nurse like me, wherever you work, you're part of a team that makes a difference. You make a difference to people's lives. Mostly we make a really positive difference, and we're remembered for doing that. Occasionally we get it wrong. The difference between us and many organisations is when we get it wrong, it can cause harm, and that affects us deeply. So we're really, really keen to learn from that. And I think there's something that you can all learn from that approach in terms of how do we actually keep looking for more that we can do to get it right.
And just finally, to finish off, in just a couple words or maybe one sentence, what would be like the main message that you want to get across to teenagers from this interview? What's the main thing that you want them to realise and say, actually, I'm going to start turning my life around now?
So I would say that you can be anything that you want to be. You can do anything that you want to do if you're positive and you have the right mindset. But do it with care, do it with compassion. You will never ever, those skills will come in handy for you no matter what you do in life, and you will be so much more successful. It's so much easier to do things right and well and kindly than it is to do them wrong and poorly and with bad behaviour.
Exactly. Okay, thank you very much.
Thank you very much. That was quite a grilling.
It's nice to meet you.
Okay. So obviously E2M isn't strictly a mental health charity, but in terms of mental health, how important do you think early intervention is compared with provision for those with already established complex mental health needs?
Okay, so people with already established complex mental health needs need a very, very different, they need a high level of care, they need constant input and support. If we can stop them ever getting to the point where they need that, imagine how much different their lives would be. So, you know, imagine what it would be like if you had never gotten yourself into that position where you'd listen to your peers, you'd taken drugs, you'd then gotten into trouble, you'd then got depressed, then your health started to suffer. You know, imagine if that had never happened in the first place and got you into this cycle where you were unable to cope with anything without having to harm yourself or find a coping mechanism that's unhealthy. E2M for me provides a coping mechanism for young people that is healthy. It enables them to put their efforts into something that is going to give more back to them than they'll ever give. So for me, early intervention is what it's all about, and not just for mental health, but also for any other health condition, for people with alcohol problems, for people with drug problems, for people with chronic conditions, for people with eating disabilities. You know, all of these things, if we can intervene earlier and make it better, we'll have less and less young people with mental health problems. Society has caused a lot of these problems. The lack of opportunity for young people, the lack of positive support at an early stage has caused a lot of the problems for many of our teenagers.
Obviously, unfortunately, we can't have early intervention for everybody. There are still people who are going to carry on further. So why is it that lots of nurses on paediatrics wards still say they have little to no mental health training?
Actually, we do have some. We have basic mental health training. We were the first trust, Morecambe Bay Hospitals was the first trust in the country to actually employ mental health and learning disability nurses in general wards. And we did that because we recognised 1 in 5 of us has a mental health problem. People in my family have a mental health problem. You know, if you ask a room full of people to put up their hands if they know somebody with mental health needs, every hand in that room is likely to go up. It is really big. So if 1 in 5 in our population has that mental health problem, 1 in 5 of our patients in hospital has a mental health problem. We cannot ignore that, and we cannot not have those skills available. And we're working very, very closely with Lancashire Care, who are our mental health provider, to set up more and more support. We're also working with Mind. And we're working with charitable and volunteer organisations to support early interventions, things like crisis cafes and things in the community. My daughter actually goes to a charity once a week to do sports. She has mental health problems and she goes to do sports, and that really, really helps her to meet with other people who are finding different ways to cope with the pressures of day-to-day life.
So CAMs in this area are one of only the few where the intake stops at 16 and there's no provision other than crisis teams for 16 to 18-year-olds. So what's going to happen about that?
So we're working with our commissioners and the local mental health care providers at the moment to address that very, very issue, because there is a gap, and it's a significant gap. And the people who suffer most are the young people, the patients themselves, the young people with mental health needs. It isn't good, and I'm not going to pretend it is. And we do end up with a number of people with mental health, young people with mental health needs in paediatric wards for people with general health needs rather than specialist mental health needs. And we're working very, very closely with them to look at how we can actually improve that across the whole of Morecambe Bay area.
And finally, just coming full circle, if you could sum up Escape2Make in 4 words, what would they be?
Opportunity for life. Go. I had to put a 4th word on.
Well,
Is that all right?